Emergency medicine specialist who's previously volunteered in Gaza, a senior consultant and professor emeritus at the University Hospital of North Norway. And also, Mads, you have also trained many of Gaza's junior doctors. They may be senior doctors by now. Can you tell us a bit more about Guillain-Barré syndrome?
Yeah, or the doctor sadly may be killed, actually, because Israel has, as you know, killed more than 1,000 healthcare workers, among them many of my colleagues. The Guillain-Barré syndrome is a post-infectious paralysis. It's well known. It's a dramatic consequence of an infection, in particular in an individual with reduced immune capacity. And the condition in Gaza now is precisely the condition created to be productive of this kind of syndrome. Yesterday, the 4th of August, the Minister of Health in Gaza issued a new report alarming on the conditions, and they say that the Israeli-led blockade and violence in Gaza has led to overcrowding, lack of sanitary conditions, contaminated water, starvation, and a total blockade of vaccination campaigns, unquote. And these are precisely the conditions made for producing Guillain-Barré. So Guillain-Barré is just another symptom of the underlying problem, which is the totally inhuman siege of Gaza, combined with, as you said, the bombing and the displacement again and again. What we see now is a concentration camp under full control of the Israeli army, supported by the US, and with nothing but words from the Western governments, and also, I'm sad to say, the Arab governments. So what we are witnessing now in 2025 is a systematic genocide and an ethnic cleansing based on the use of siege and blockade and these slow killers, which is malnutrition, infections, lack of soap, lack of water, lack of toilets, and this will inevitably cause a mass infection situation. And also warned by the Minister of Health, Dr. Youssef Abarish, this may spread to the region because the Israeli soldiers, the occupation soldiers, are crossing in and out. So Guillain-Barré, once you have that paralysis, you will often need a ventilator, which is almost unavailable in Gaza, an ICU bed, which is almost unavailable, and of course you need power to the hospital treating these, and only 5 of the 38 Ministry of Health hospitals in Gaza are having some partial function, 5 out of 38. The others are closed down, bombed, destroyed, and the lack of fuel makes it almost impossible to treat these complicated Guillain-Barré conditions with a paralysis.
Mads, if this, as you're saying, is man-made, we shall wait to see what the accountability is when the chips are down and there are decisions being made, legal decisions regarding prosecutions, etc. From a medical point of view, if there's no baby formula available for a newborn, how is a mother who's not eating properly able to provide breast milk for the baby? That this is a growing problem for new mothers and their babies.
Yes, absolutely, you're right. And you know, nature has made it so that one of the last things that leaves a nursing mother with a newborn child is actually her breast milk, her breastfeeding capacity. But given the extent of malnutrition and the duration of malnutrition of the hundreds of thousands of pregnant women in Gaza, they lose the breast milk. They lose the capacity to breastfeed their kids. And the last report from the Minister of Health, the Geography of Humanitarian Situation, shows indeed that there is a marked increase in stillbirth, in neonates underweight, and in children needing acute nutritional support. Actually, the number is staggering, and 200,000 cases of diagnosed malnutrition in children are documented in Gaza, and 260,000, more than 250,000 children under 5 are in acute need of nutrition. Now, that is not solved with some smart business people from Israel trying to make a profit out of this devastating humanitarian disaster. This is not solved with 10 or 20 or 100 trucks. This will need 1,000 or 2,000 trucks per day. And bear in mind that the leader of the World Food Programme last week said that there is enough stockpiled food and humanitarian support outside Gaza to feed the whole population for 2 months. So the only solution to this is an immediate opening of Gaza to UN-controlled international help. And, you know, humanitarian help is non-negotiable. It is a human right. So I think it's time now that the Western leaders in particular understand that resolutions and paper is not going to feed the starving people in Gaza. Goodwill is not going to feed the starving people in Gaza. Goodwill is not going to stop the killing of children in Gaza. It's only one thing, and it is boycott, divestment, and sanction, hitting Israel so hard that they have to stop this criminal occupation and killing of civilians.
Dr. Mads Gilbert, thank you very much for your time, sir.
Thank you.